Early Pregnancy Signs Explained, a week-by-week guide. So, you're in that weird limbo between thinking you might be pregnant and actually knowing for sure. You're second-guessing every little twinge. Is that cramp just my period coming, or could it be something else? Is this exhaustion from a brutal week at work, or is it a sign? The what-ifs can be completely overwhelming, and the waiting feels like it takes forever. In this video, we are going to cut through all that noise. We'll break down the very first weeks of pregnancy into a simple, visual timeline from a medical perspective, so you can finally understand what's happening in your body, what signs to look for week by week, and exactly when to take that pregnancy test. Hello and welcome. That time, often called the 2-week wait, can be packed with anxiety, hope, and a lot of confusion. Every little change in your body is suddenly under a microscope. Our goal today is to give you a clear, science-backed guide to what's really going on. We'll walk you through the hormonal shifts and the physical signs, starting right from the moment of conception. Think of this as your biological roadmap for the first trimester. We're going to cover the very first, most subtle signs, help you tell them apart from normal pre-period symptoms, and create a timeline so you can better understand what your body is trying to tell you. It's so important to remember that every single pregnancy is different. Some people get a long list of symptoms and others get none at all. This guide will help you understand the whole range of what's normal. Decoding the timeline, weeks 1 and 2. All right, first things first, let's clear up something that confuses almost everyone: how pregnancy weeks are actually counted. Medically speaking, your pregnancy is dated from the first day of your last menstrual period, or LMP. This means that during what doctors call weeks 1 and 2, you aren't actually pregnant yet. Seriously, week 1 is your period, and week 2 is when your body is gearing up for ovulation. That's the big moment the egg is released. Conception, when the sperm meets the egg, usually happens around the end of week 2 or the start of week 3. So when you hear someone is 4 weeks pregnant, it really means it's only been about 2 weeks since they actually conceived. This standard dating method is just how doctors and midwives track a pregnancy's progress. Understanding this is the key to figuring out when symptoms might realistically start showing up. Week 3, the journey begins. Week 3 is where the magic really starts. After fertilization, this tiny new cluster of cells, called a zygote, starts an incredible trip down the fallopian tube toward the uterus. Along the way, it's dividing and growing at an unbelievable speed. At this point, though, you wouldn't feel a single thing. There are no pregnancy symptoms yet because this little ball of cells hasn't attached to your uterine lining, and your body hasn't started making the main pregnancy hormone in any significant amount. That hormone is human chorionic gonadotropin, or HCG, and trust me, we'll be talking about it a lot. For now, your body is totally unaware that anything is different. Week 4, implantation and the first clues. This is where everything changes. Around 6 to 12 days after fertilization, which lands us squarely in week 4, the ball of cells, now called a blastocyst, finally arrives in the uterus and starts to burrow into the uterine wall. This whole process is called implantation, and it marks the official start of your pregnancy. This is also the very first time you might see a physical sign, implantation bleeding. As the embryo snuggles in, it can disrupt tiny blood vessels, which might cause some light spotting. Now, here's where the confusion kicks in, because this can happen right around the time you'd be expecting your period. So, how are you supposed to tell the difference? Well, implantation bleeding is usually very light. Think spotting, not a real flow. It's often pinkish or brownish and might only last for a couple of hours or a couple of days. Your period, on the other hand, usually starts light but then gets heavier and is typically bright red. You won't see any clots with implantation bleeding, which can be common with a period. Some people also feel mild implantation cramping, which can feel like light period cramps but is usually less intense. At the same time, the placenta starts to form and immediately gets to work producing HCG. This is the hormone that a pregnancy test is looking for. It tells your ovaries to stop releasing eggs and to ramp up production of another critical hormone, progesterone. Progesterone helps keep the uterine lining thick and healthy to support the growing embryo. These rising hormone levels are what set off the whole cascade of symptoms to come. But at this stage, the most reliable sign of all is still a missed period. Weeks 5 to 6. The hormonal surge. By weeks 5 and 6, your period is officially late, and HCG levels in your body are skyrocketing, often doubling every 48 to 72 hours. This hormonal surge is when many people really start to feel pregnant. One of the most common and earliest signs is a level of fatigue you've never felt before. This isn't just, I'm a little tired. It's a deep, can't keep your eyes open exhaustion. This is caused by the massive spike in progesterone, which is essential for the pregnancy but can also completely drain your energy. Your breasts might also become incredibly tender, swollen, or sore, kind of like your usual pre-period soreness, but turned up to a level 10. The area around your nipple, the areola, might start to get darker or bigger, and you might notice the veins in your chest are more visible. This is all your body getting ready for milk production way down the line. And then there's the peeing. If you suddenly feel like you're living in the bathroom, that's another classic sign. The pregnancy hormone HCG increases blood flow to your pelvic area and kidneys so they work more efficiently. Plus, your uterus is already starting to grow and put a little pressure on your bladder. Section 5. Weeks 6 to 8. The classic symptoms. Welcome to weeks 6 to 8, which is when the most famous pregnancy symptoms often make their grand entrance. For up to 80% of pregnant people, this means nausea, better known as morning sickness, but that name is so misleading. It can hit you any time of day or night. This queasiness is thought to be caused by the rapid rise in hormones, especially HCG. For some, it's just a mild, lingering nausea, but for others, it involves actual vomiting. You might also develop a superhero-like sense of smell, where scents you used to love are suddenly repulsive and trigger that nausea. Food cravings and aversions usually show up around now, too. You might suddenly need pickles at midnight or not be able to stand the smell of your morning coffee. This is all thanks to that hormonal roller coaster messing with your senses of taste and smell. Let's talk about digestion. Progesterone, the same hormone making you tired, also relaxes smooth muscles all over your body, including your digestive tract. This slows everything down, which can lead to bloating, gas, and constipation. It can also relax the valve that keeps stomach acid where it belongs, leading to some lovely heartburn. Section 6. Weeks 9 to 12. Your body adapts. As you head toward the end of the first trimester, your body is still in full-on adaptation mode. You might notice more vaginal discharge. Now, this can sound a little weird, but a thin, milky white discharge called leukorrhea is perfectly normal. It's caused by increased estrogen boosting blood flow, and its job is to help protect the birth canal from infection. As your uterus expands, you might also feel something called round ligament pain. This can feel like a sharp, quick ouch in your lower belly or groin when you stand up too fast or cough or roll over in bed. It's just the ligaments that support your uterus doing a big stretch. You might also see some changes in your skin. Some people get that famous pregnancy glow, which is just from increased blood volume making your skin look brighter, and others might get a flashback to their teen years with a new bout of acne, thanks again to those hormones kicking oil production into high gear. Section 7. What to do next. Your action plan. Okay, so you've been tracking the signs and you think you might be pregnant. What now? First, take a pregnancy test. I know you want to test ASAP, but for the most accurate result, it really is best to wait until the first day of your missed period. Testing too early can give you a false negative just because your HCG levels aren't high enough to be detected yet. Pro tip, use your first morning urine, since that's when the HCG is most concentrated. If the test is positive, congratulations! Your next step is to schedule your first prenatal appointment. Most doctors or midwives will want to see you for your first visit when you're around 6 to 8 weeks pregnant, which is about 2 to 4 weeks after your missed period. This first appointment is usually the longest. Your provider will confirm the pregnancy, take a detailed medical history, and do a physical exam. They'll also calculate your due date and might do an ultrasound where you could even see the baby's heartbeat. This is your time, so come prepared with all of your questions. It's also really important to know which signs mean you should call your doctor right away. If you ever experience heavy bleeding, severe abdominal pain, intense pain on just one side, or you're vomiting so much you can't keep any liquids down, you need to seek medical attention immediately. So, the bottom line is this. The first few weeks of pregnancy are a time of incredible, unseen transformation, from that quiet moment of implantation to the powerful hormonal surge that leaves you exhausted and queasy. Your body is working so hard to create a new life. Remember, this timeline is just a guide. Some people will feel nearly every symptom we talked about, and others will feel nothing at all, and both of those experiences are completely normal. The most definitive signs will always be a missed period and a positive pregnancy test. Trust your body, listen to what it's telling you, and never hesitate to reach out to a healthcare provider. This journey can be both thrilling and a little terrifying, and you are definitely not alone. Let me know in the comments if you're in the 2-week wait, if you've experienced any of these signs, or if you've already gotten your positive test. Your stories and experiences can help so many other people in this community. If you found this guide helpful, please give this video a thumbs up and be sure to subscribe and hit that notification bell for more medically backed guidance on your pregnancy journey. For your next watch, I highly recommend our video on what to expect at your first prenatal appointment, where we dive even deeper into that big first visit. Thank you for watching and take care.